Ms. Capps.
Thank you very much, Dr. Wakefield. I have a couple of questions for you during my time. One is to share with you my concern to learn that the Centers for Disease Control and Prevention, CDC, estimates that the number of births to women living with HIV has increased approximately 30% from 2000 to 2006. There are all kinds of new phenomena arising within this area of HIV/AIDS, chronic length of living with the disease, and a whole new raft of issues that need to be addressed. I'm sure you are considering this something that needs to be dealt with as well. Do you have any ideas or plans in place to address the needs of women and children and families in light of the growing numbers of HIV-positive women of childbearing age? Perhaps you can discuss, if you will, how Part D of the legislation will help to ensure that their needs are met.
Well, you're right. Part D is the part of the Ryan White program that is probably most targeted toward exactly the population of which you are concerned. It, of course, allocates funds through public and private organizations, community-based organizations, states and universities. And it can provide outpatient or ambulatory care directly to or through contracts that are awarded. It is really designed to serve women, infants, children living with HIV/AIDS support and provide support services to those individuals. That's really its key target population. We also have resources that are available through Part F, the SPINS program. It's referred to a shorthand, that can be allocated to direct research and other activities to particular target populations. So that's another vehicle that I think it's safe to say could be added. Beyond that, Parts A, Parts B, and C also provide care to the population that you've just expressed concern. But as you indicated, Part D is really targeted to, as mentioned, women, infants, children, young adults.
Thank you. And part of our goal then, in our communities especially, is to identify and encourage people to get tested so that they can understand that they are and that they can get into some of these programs and being able to deal with it early on. To that topic, I'm concerned. You heard in several opening statements about the impact of several of our state budgets on the ability to care for HIV and AIDS patients. I've heard just horrendous stories in my district in California about matters of life and death, really, if our state budget is going to cut so drastically the services on which people really depend for their care. They're going to have to choose between their medicine and their food. I mean, I'm sure it's not just confined to my district. I can see people in your audience nodding. And I know this is a story across the country now. How can we respond? How can HRSA respond to work with some of our states where this is such a huge challenge right now?
Well, you're right. We've been hearing from a number of states about the challenges that they're facing locally. And certainly California is one of those states that we're trying to monitor and work with as closely as possible. On the front end, the administration, of course, strongly supports continuation of this program, first and foremost, to provide vital funding to states and cities to provide services to people living with HIV/AIDS. In part, perhaps, to address your question, it might be useful for you to know, too, that the President's fiscal year 2010 budget request asks for an increase of about $53.9 million over the fiscal year 2009 omnibus level. That funding would continue to support over 2,300 providers that would help 500,000 individuals living with HIV/AIDS obtain access to life-sustaining care and services. So, in fact, there is an additional request, a request for additional funding, I should say, that should help to mitigate a bit of those concerns. But bottom line, we are aware of that and working as closely as we can with jurisdictions and states that are feeling particular pressure to maintain their services to this very vulnerable population.
Well, you can be assured that there are many members of our Congress, and including in this committee, who will seek to look for further funds if that is necessary as we see some of these state budgets unfold. I don't think it's really hit yet as hard as we're going to see in the coming months, where we are really facing in our communities. It's not just this population, unfortunately, but this is one that is clearly made itself known to me, and I know my colleagues will share in wanting to help you with it if there's any emergency funding that can be made available. And surely the increase in the budget for next year is going to be something, it was intended, I'm sure, to expand services, but at least it will provide that stopgap, hopefully for some of the states where the bottom's falling out. And I appreciate your awareness of and concern for this situation.
Again, and we are aware, we are concerned, and we have been trying to collect data, or information at least, anecdotally from our contacts in each of the states. So we've got a little bit of a litmus test about how things are going at the state level. We'll continue to try and do that and ensure that information is available.
We'll encourage them locally to reach out to you, let you know what the status is. Thank you. Thank you, Mr. Chairman.
Thank you.